Hi, Dr. Saxena here, and we have been talking on some of the things which really help you sustain the good health. And yes, and this I'm trying to cover a lot of what are the possibilities, what are the nutritional possibilities, what are the stuff we have over as which are having as a fruits and all that, which can really make a difference. Is I've been talking about. This is something which I am trying to work with at trend kind of thing. It's randomly I'm picking up some things. I was talking to one of my patient who has got some problem with his. It is basically a cancer, which was a brain cancer, and I've been telling them to go something for a ketogenic diet. What is the ketogenic diet and what is the Atkins diet? How we work it out? What are the low carbohydrate diet? So the easiest thing which I was trying to put across to this person is telling them you start using the coconut oil. Coconut oil. Let us start with that particular stuff. See, I believe coconut oil is a one of the best food which is available, and it's derived from the white flesh of the coconut, which is a palm tree. Most of the health benefits of coconut oil are attributable to the high content of medium chain saturated fatty acids. It's called MCT. In this particular thing, we have got something like capric acid, caprylic acid, and lauric acid. Um, Unlike most other dietary oils, coconut oil doesn't contain trans fatty acids because due to the very low content of something called unsaturated fatty acids. So here what I'm trying to propose is this is one of the things which my patient is going to follow, taking some coconut oil, trying to reduce the carbohydrates, and that modified ketogenic diet essentially helps in a lot of ways apart from the keeping in check the tumor growth. That's the main essence of that. So what are the other things? This particular thing, it helps, coconut oil helps in the immune system by it is killing some of the detrimental bacteria which is killed. It can Helicobacter pylori, which is much hyped about that. Is because of this gastric ulcer and so many reasons. Now we know Helicobacter is causing so many problems, and this is one thing. Just coconut oil is helping that particular thing to kill that particular bacteria. Apart from that, it helps in killing that detrimental fungi. Again, I had done a lot of work on this antifungals and all that, and right from my days of working with autism and even in cancer, we believe that the moment we stop, we are trying to keep in check with the fungal growth. The fungus is a nasty kind of stuff, and all this mycotoxins. But I can always tell you, this coconut oil is an amazing antifungal. Again, because of this caprylic acid and lauric acid kind of thing. The way it improves immune system is it may delay the shrinkage of thymus. See, usually you have got in your when the child is till your puberty or something like that, till you are 10 plus, till you cross the 10 thing. So the thymus starts. Thymus is a gland which is below the chest wall, retrosternal gland, and if you have got thymus which is working, and your immune system is good. So usually by the time you reach adulthood, this time thymus atrophies, and by using coconut oil, you can delay the shrinkage of thymus. It's a big thing. Apart from that, I've told you about bacteria, I told you the fungus. The other thing I would like to tell you about the viruses. I have been talking about in my protocols the people who would like to were worried about how to prevent this corona and all that. What are the steps we need to take for that particular? The first thing what we have wrote and we have told our people is to cut down sugar, cut down, and add something like 30 ml of coconut oil in the morning and 30 ml in the evening. Yes, this coconut oil inactivates some of the nasty viruses, including HIV virus and cytomegalovirus. This is proved. We have got references I can give, which usually because of this high lauric acid content, these viruses are kept at bay. So apart from that, we have suggested coconut oil for people who are quite obese. They want to lose their weight and they want to. There is a kind of thing because it increases the body basal metabolic rate. I can always debate this particular thing. Apart from that, the coconut oil lowers the cholesterol, elevated serum cholesterol, which is high. Coconut oil stimulates the conversion of cholesterol to pregnenolone. And once there's a pregnenolone is from cholesterol, you get into pregnenolone, you can always go towards vitamin D, you can go towards hormonal and all that. So it really makes a wonderful thing. And yes, I can always give a lot of references where there is a lot of study which showed the coconut oil lowers the body weight. It's because of this particular reason. It elevates the dry skin and kind of stuff, which is I always believe like dry skin is a common thing. Usually postmenopausal people and geriatric age group people, they usually come with that dry skin, and people with hypothyroid, they are having this problem of dry skin, and it's sometimes very nasty. So this is how we try to work with this coconut oil, this amazing kind of benefits, right from your immune system to skin to metabolism to cardiac health. Kind of antiviral is a big kind of take, and we had been talking for the last 1 year to everyone to follow that and coconut oil intake, and it is really causing that if you have got that dysbiosis in the intestine, is the one thing which is to be taken on a regular basis. Coming to the contents of the coconut oil, if I can, medium chain triglycerides are maximum. You have got something like I already told about. There are saturated long chain fats also, which can be include palmitic acid apart from the MCTs. You have got some oleic acid, you have got some vitamin E, you have got some tocotrienols. So this is and the easiest part with the coconut oil is it's resistant to rancidity. If you leave it for some time, like you leave the butter, it gets rancid. If there's a thing called peroxidation occurs, the butter, you change the kind of, it becomes quite yellow. Whereas this coconut oil, this lipid peroxidation doesn't occur. So unlike all the oils, shelf life of this coconut oil is much higher. It can, I can tell you, this coconut oil can be kept for a year, and you can just keep. You don't have to keep in the refrigerator. And this is there is, after keeping a year also, there is evidence to show that there is a kind of somebody has done prove that there is no rancidity which occurred as such. Unlike the other dietary oils, this coconut oil doesn't contribute to development of cardiovascular disease. On the other hand, it is reducing your cholesterol and all that. And let us see what is what I'm talking about. Let's go into something like medium chain fatty acids, and it has basically medium chain fatty acids have the carbon length of about 12 is to C, 12 is to 1, 12 is to 0. So all this thing with health benefits of lauric acid working on the detrimental fungi, bacteria, and the why antivirus? It is because because of this lauric acid. Lauric acids, we have reasons to say lauric acid suppresses something like measles virus as well as the influenza virus. It's a big take, and there are some other stuffs which we always what are the other sources of lauric acid? One is the coconut oil, which has got the richest. It has got something like 48,000 kind of concentration in coconut oil. The second thing which has got high lauric acid is saw palmetto as well as hawthorn, and you have got the what we try to work it out with the therapeutic dose is I would prefer something like about 24 grams per day. So if I am taking something like 2 tablespoons 3 times a day, that is 6 tablespoons. That is enough for me, like to have that coconut oil. Something around 30 ml is the kind of thing. 3.5 tablespoons and all that. So just this is one thing which is slowly commercially kind of thing. Availability is there, and so this is the with this background. I definitely look into this particular thing called medium chain triglycerides, and I have reasons to say some this particular medium chain triglycerides, usually lauric acid, capric acid, and caprylic acid, which is rich in coconut oil, improves the health benefits of this MCTs are tremendous. One is digestive system. It helps in improving the condition of Crohn's disease. You have got gastric ulcers and duodenal ulcers are easily can be sorted out with this. MCTs prevent the gallstone formation. Somewhere this is because this medium chain triglycerides can be reabsorbed and hydrolyzed without the use of bile acids or pancreatic lipase. So there is no kind of the prevention of gallstones. One thing which you should always look into is advise them to go for this MCT oils. Even people with ulcerative colitis, the condition has improved on this particular stuff. Coming to the metabolism and all that, I have seen people, athletes using coconut oil, this MCT, and we had some of the people who are advising for diabetic management also. You need to be careful to try to. It's a kind of, I can't say it's a double-edged, but we need to be careful how we can go for that. So this is the thing with which it is helping in lots, like athletic performance. It increases the basal metabolic rate to about 40%. It elevates cirrhosis, it improves glucose metabolism. This is why I'm talking about in type 2 diabetes. You have got, by increasing the insulin sensitivity, this is going to be a good game changer. Apart from that, you have got people can think of preventing hypoglycemic episodes, and people having dysfunctional liver, people having obesity, all of these people can get. One common thing I can always tell you, you want to increase your stamina, go for this MCT oils. And I can always tell you, when consumed in conjunction with the glucose, by providing that rapid burst of energy, I have research papers with combining these two things. You can get that kind of rapid burst, and yes, it is can be looked into. And I have used coconut oil in people with brain tumors, people with epilepsy, people with autism, people having problems with brainwave patterns and all that. And so my foray into this particular thing, I always believe, try to pick up what is natural things, what you have, and try to work on that. You need not go for very big things. The problems are indeed complex, but the way we can always look into trying to provide this MCTs, trying to provide this, change the metabolism of the body, and that makes a very interesting kind of thing. and with very little of medicines, pharmaceuticals, and I can always tell you, with using this kind of stuff, you can definitely keep all the diseases at bay. Even if you have something which is very nasty ones, you try working with this one, a few of the things, and I'm sure this is one thing which helps in almost all this one. That particular stuff, what we are trying to look into, that capric acid, caprolic acid, as well as lauric acid. This is one of the things which it took me a long time to, when I was working on this nutrition medicine, which of course was not a part of your MBBS training. And I thought, let me talk about this coconut oil. And I can always go on and on. And this is one simple thing which you can help optimize your health, take out that disc from that disease, and keep each separately. So one of the best foods which I believe is coconut oil. Thank you.